Thank you very much to the chair. And let me say what a pleasure it is for me to moderate this session. I had the opportunity of talking to each one of you. And Sam Ohuabunwa, I was thoroughly amazed at the depth of your experience in Nigeria in trying to build the Nigerian healthcare industry and over the years. And I think it would be great if you could share this experience of yours in trying to localize production of pharmaceuticals in Nigeria with the audience today, and perhaps also tell us a little bit about your efforts to regionalize production across the West African region, where you've also worked as part of your many roles that you have played in the pharmaceutical sector. Over to you, Sam. Thank you.
Thank you, Faisal. Thank you very much. Thank you, Mabel. And thank you, Dr. Kebe, for being a poster boy for what I think is the needed governmental and positive governmental intervention that is required to drastically upscale local pharmaceutical manufacturing and value addition. So I want to congratulate you for the advice you've given to the Ethiopian government and for the very ambitious project. For me, as Faisal said, I've been in the industry for about 40 years now, even though I am pretending that I have retired in the last couple of years. But I am completely intricately, linked to the industry one way, no matter where I went. For me, looking back, I think the first problem we had in the Nigerian pharmaceutical space was that the industry was very fragmented. At the beginning, there were a few companies mostly doing similar things, and there was no coordination, and so the industry could not organize. So the first thing we did was to try to organize the industry to get into what we call the Pharmaceutical Manufacturers Group of Manufacturers Association of Nigeria, called PMG-MAN. And as I speak to you, we started like 10. Today we have over 150 companies that are local manufacturers that are in this group. Of course, at some point there was this issue of some misunderstanding or mistrust between the international companies or internationally supported pharmaceutical companies and those that are indigenous. At the time, there was a fragmentation of indigenous pharmaceutical manufacturers and then the other pharmaceutical manufacturers. Again, that reduced our ability to properly advocate and make our case to government. And one of the things we were able to do was to unite both. And so today we have only one pharmaceutical manufacturers group. We also had the issue of how do we get appropriate data, because I don't know about the rest of Africa, but in Nigeria, data is an issue, and reliable one becomes even a greater issue. And so we're trying to build an internal capacity to generate data, because without data, you can't properly plan. You can also not properly carry out advocacy with government. And we did that. And today, the PMG-MAN can reasonably provide data of who is doing what and where one is and where one is not. Then we looked at the issue of raising standard of the product, because we had to face competition from India, from China, and from the rest of the world. In fact, Nigeria ran and still runs a very open door policy. So at some point in Nigeria, it was a free-for-all, and drugs from everywhere in the world came to Nigeria, and along with them came superiors and substandard medication. And so we began to deal with that issue, and to be able to make a case for proper regulatory intervention. The one thing we needed to do as industry was to see how to raise standard, to raise our quality. and we set up internal quality mechanism. We had a committee of quality managers that went from factory to factory, in reviewing what they were doing and qualifying them, even over and above what the regulatory agencies that were doing. Of course, the regulatory agencies were also a little bit tardy at the first, and Nigeria then developed into what they call the NAFDAC, National Agency for Drugs and Food Control, and that has increased the ability of the local industry to meet minimum standard. And we have gone beyond the pure NAFDAC or local regulatory standard. We also looked at international standards, and today we have a few companies that have WOGMP compliant status, which is also critical, not only to ensuring that we have good local standards, but that we could compete, because in a free world, in a global, in a world where, you know, in the 21st century world, with deregulation and all that came with it, we needed to compete. Otherwise, there was no way we could have a way in the marketplace. The other issue we needed to deal with was how to increase government appreciation of the contribution of the pharma industry to the economy, and also the relevance of having local drugs as a major economic benefit, and also as a national security issue. And that led the government of Nigeria to establish a policy where they had put a target that by the year 2005, we should be producing 70% of the essential drugs we needed in Nigeria locally. And that was a government policy. But of course, it's one thing to get a policy, the other is to see that policy work. And as I speak to you today, maybe we're doing just 40%. 40% of the drugs or essential drugs we consume in Nigeria still come from outside Nigeria, despite that government policy. And of course, that was due to some of the issues which Akbe had raised in his keynote. I mean, we talked about infrastructure. In a situation where there was such heavy infrastructure deficit, you had to create your own power, tie your own road, provide your own security, provide your own water. There was no way we could really be competitive, and that gave way for spurious products and all kinds of smuggling activities into the industry. We have gone far in looking for how to grow capacity, because again, beyond infrastructure, we needed long-term funding, and we had to make that case to the banks. Of course, it was difficult for banks to understand the kind of long-term funding that we needed to promote through not only local value addition, but to begin to go do some backward integration and produce some local raw materials, excipients, those things that we didn't have to import. Because it was not only that we are doing 60% importation, but even the 40% we produce locally, 70–80% of raw materials came from outside, including excipients. So that is something that I think, as of today, which is what COVID has brought for us, government of Nigeria has eventually paid attention to the industry. And during this COVID period, the Central Bank of Nigeria provided 100 billion Nigerian naira to the industry to help them scale up capacity. And then went beyond that to also support research. For the first time, Central Bank of Nigeria was making money available to research companies, research institutions, and researchers who wanted to do some work. That was so much. I mean, that has done well to move manufacturing in Nigeria on the right pace. Let me make a few comments about our challenges in building regional capacity in West Africa. As Faisal said, I was the founding president of the West African Pharmaceutical Manufacturers Association. And that was because we thought that this idea of each country, each person competing, we would not be able to compete against the rest of the world, against Asia. We needed to come together as a region, build capacity, and have some strength to compete. So when we came as WAPMA, we were looking at a couple of things. First is to bring some integration into first regulatory integration, so that we didn't have to register every product in every city, in every state in Africa. We needed to have a regional integration where we can have some ability to register one product in a state within the region, and then it can be sold in other regions. We had opportunity to get to lobby ECOWAS countries to take some regional wide initiatives to support manufacturing, so that fragmented manufacturing will be minimized, and we could build capacity, also build competence. And this is what we're working on. So I think the lessons we learned are, one, we need regulatory harmonization to be able to operate in Africa. Now that we have AfCFTA, there must be a regulatory harmonization. We must remove obstacles, take away nationalism, because today you see here that Nigerian businessmen are being driven from Ghana, or they fight somewhere else. Africa must overgrow that. If we must do regional trade, African free trade, we must know that we are one block, one nation, and everybody should have the freedom to trade, to live, to work in every country of his own choice. So our political leaders must sell to us oneness. We must agree that we are one continent, one people, so we can do business together. Otherwise, we might not just make it. So regulatory harmonization, removal of obstacles, regulatory joint regional advocacy to ECOWAS, to EU, and learning from each other will be some of those things that will help us to build capacity and ensure that we can produce a lot more, reduce our dependence on imported pharmaceuticals, and build capacity as we learn from COVID-19. Any nation, any group that depends on a third party for the supply of its essentials will run into some dangers when those third parties decide to deal with their own domestic issues first. These are some of the things I think we have the opportunity to correct as we move forward. And I think Ethiopia and a few other African countries are showing good examples. Thank you. I hope I haven't overshot my time.
Thank you very much, Sam. That is an amazing reflection of the depth of your experience, also your passion for the industry. And I think that the points you made about Africa just can't be dependent for its essential drugs on other countries in the world. And you sent a strong message that we can work together, we should work together as a continent to build our own capacity. Thank you so much.